I'd like to thank Dale, even though he's not here this afternoon. He gave me a wonderful lead-in to start talking about this. As he was going through his timeline, he talked about Hillary Care in '93 and '94 and how it disappeared without anything really being accomplished. Well, there was something that happened in 1994. That was a round of rural hospital grants came down to provide rural transportation for hospitals. And that's where two of these contracts originated. The oldest of the contracts is with Fitzgibbon Hospital in Marshall, Missouri, which has a population of approximately 12,000 people. It is a 60-bed facility, and this is perhaps the most interesting of the contracts that we have, because the hospital in Marshall decided that they were going to take over all the public transportation from the city of Marshall. The city of Marshall provided a bus, and Fitzgibbon provided all the routing and administration and scheduling, and Oates provided the service and the trained driver. Another of the older ones that we have originated through that same grant, and that is in Nevada Regional Medical Center, and it has a 63-bed facility. And they also took over a portion of the public transportation from the city of Nevada, though they did not take over all the public transportation, just that portion that they felt was the most important to them. We currently have 2 buses that run in the city of Nevada, and Oates now provides those buses, although when the program started, there was a leased vehicle that we started the program with. The next one that I have is Bates County Memorial Hospital in Butler, Missouri, which has a population of approximately 8,000 people. This is a 60-bed facility, and we also run the bus for them while they do all the routing and scheduling. That is the one thing that all 4 of these contracts have in common, and it is one of the rare things they have in common. They are so diverse in the way that they've been set up. But we always provide a trained driver, and they always provide the routing and scheduling. Everything else is different. And last but not least, in 2006, we started a new hospital contract with Golden Valley Memorial Hospital in Clinton, Missouri. It is the most recent of our contracts and the one that has perhaps the most data, because they are still trying to track their data and figure out how this program is working for them. Whereas with the older contracts, they've just decided at this point that they're working out really well and they don't track a lot of information anymore that we would find important. One thing that I ask all of these administrators and schedulers as I was visiting with them about what we're doing for them is any advice that they would give to a transportation company or a hospital that was trying to set up this type of transportation system. They had very, very different responses. Fitzgibbon, since they took over the general public portion for the entire city, their response was, don't bite off more than you can chew. At this point, they are overwhelmed with trying to provide service to Walmart and the grocery store, as opposed to getting people to the doctor's office and the hospital. Nevada, their program has worked out so well that they had a very, very hard time coming up with any one thing that they would tell you that they had learned that you needed to avoid. But finally, the one thing they came up with was, once you've set your rules, be sure that you stick to them. You know, you may drive Mary back and forth to the doctor's office every Friday, but don't drop her by the grocery store because she needs to pick something up, because if you do it for Mary, then you're expected to do it for everybody. And they have learned that lesson the hard way. Golden Valley, the most interesting comment I think I got was the dispatcher there. She said that bus is running around town. It has that 800 number emblazoned on the side of it. So people don't just call her for trips. That 800 number is called for everything that anybody needs for that hospital, because that's the number they know. And so she said she is almost more of a switchboard than she is a scheduler at this point. But the best comment, and I told Kelly Phillips at Bates County Hospital that I was going to use this when I got here, was he said the one piece of advice that he would give you is call Oates. Just a little plug. But his stance was not just necessarily Oates, but whatever public transit provider you have in your area. He wanted something that took no effort on their part. They needed the transportation, but they didn't want to be a transportation company. And he said that this has worked out wonderfully for them. He said their administration is basically nil on this program because we came in with the experience and the knowledge and the vehicle, and we just did it. So for those of you who are looking to find transportation for a medical facility, I would suggest that you do call whoever your public transportation provider is in your area, because that's a good start.